Hi, welcome to AMSA UTAR. In conjunction with AMSA Community Service, we will be uploading a series of videos related to eating disorders. Here is a list of our videos that will be uploaded on a weekly basis. Please subscribe to us and turn on the notifications so you won't miss out on any of our videos. So, today we will be talking about Pica. First and foremost, what is Pica? Pica is an eating disorder characterized by the action of eating non-food items that do not contain any significant nutritional value. People with the disorder compulsively eat items that have no nutritional value. A person with Pica might eat relatively harmless items, such as ice. Or they might eat potentially dangerous items, like flakes of dried paint or pieces of metal. So, we'll start off with the causes of Pica. It's kinda sad to note that even doctors are not sure about the exact etiology of Pica, but it's more common in people with developmental problems such as autism, intellectual disabilities, mental health problems like obsessive compulsive disorder, OCD, or schizophrenia, malnutrition, and hunger. Non-food items might help to give a feeling of fullness. Low levels of nutrients like iron or zinc also might trigger specific cravings. Besides, stress plays a vital role too. This is being said because Pica is often seen in kids living in poverty or in those who have been abused or neglected. So, now that you know multiple risk factors of Pica, be sure to monitor your child most of the time to prevent them from developing Pica. As for the signs and symptoms, people with Pica crave and eat non-food items such as dirt, clay, rocks, paper, ice, crayons, hair, paint chips, chalk, and in some cases, feces. This will subsequently develop health problems depending on what the patient eats. These complications can include iron deficiency anemia, lead poisoning, constipation or diarrhea, intestinal infections or obstructions, mouth or teeth injuries, and choking. Nevertheless, it is quite upsetting to hear that there's no confirmational test for Pica. Doctors can only diagnose this condition based on the history and accompanied by tests for anemia, potential intestinal blockages, and toxic side effects of substances consumed. Therefore, the patient should be honest with the doctor about the non-food items that have been consumed, as this may help to develop an accurate diagnosis. Diagnosis process will be harder for children or people with intellectual disabilities because doctors are not able to identify what substances they have eaten. Doctors might suspect it's Pica if a child eats non-food items for at least a month, and if the behavior isn't normal for the child's age or developmental stage. To further confirm the diagnosis, the doctor will analyze the nutritional status of the individual, for example, to determine whether the individual is suffering from anemia. Besides, undergoing a blood test to determine the lead level in blood is also essential. Doctors might also do stool tests to check for the presence of parasites, as well as order X-rays or other imaging tests to find out what the individual ate. Fret not if you or your child has been diagnosed with Pica. There are specific treatment courses that will be taken by your doctor. So without further ado, let's take a look at a couple of them. Your doctor will be focused on two aspects in treatment, which are complications from eating non-food items and nutritional imbalances. As an example, lead poisoning is a common complication from eating paint chips, and it can cause many other undesirable complications like affecting the development of the nervous system. In order to halt the toxic effects of lead, your doctor will prescribe chelation therapy to remove the heavy metals from the body. Chelation therapy is given by injection or oral intake of the chelating agent, which binds with the lead and exits the body via urine. Another example would be for nutritional imbalance. Take for instance, anemia due to iron deficiency is also a common complication of pica, and doctors treat it by prescribing regular iron supplements. Other physical care, mental well-being is also prioritized in the management of pica patients. Your doctor may do a psychological evaluation to determine if the patient has OCD or other underlying mental health conditions that could serve a risk factor for pica. Now that we have acquired all the information regarding pica at our fingertips, please do not hesitate to seek professional help if you feel that you or someone you know that might be suffering from the symptoms of pica. Besides, we should also be more observant and concerned about the people around us, as they might be suffering from pica as well. Please do not regard them as outcasts, but instead try to be more considerate towards them, as their condition may improve with the support and care from the community around them. Thanks for watching. If you think this video is helpful, please don't forget to like and share it. Make sure you hit the subscribe button below and turn on the notifications. See you in the next video, and have a nice day.